Yeah, welcome Richard Craven from United Kingdom, a digital health consultant.
Indeed.
Yeah, Richard, tell us, you are a digital health consultant, the difference between Scotland and Germany and what we can learn from Scotland.
Indeed, indeed. There's a number of things. Scotland is looking to develop a digital platform, a resource platform that covers the entire healthcare economy and stores data from all of the various provider organisations. And that digital platform will be a resource platform that enables innovation by NHS Scotland, by independent software vendors, or indeed by the provider organisations themselves.
And in Germany, we say we are 10 to 15 years behind branches like e-commerce or industry. So we talk about data security, data privacy, and so on. Is it in Scotland the same? Is the healthcare behind other branches, or is the healthcare system very quickly applied to other branches?
Indeed, I mean, data sharing and data privacy is a major issue in the UK as it is here in Germany. However, in terms of providing healthcare, efficient healthcare, it's acknowledged that data sharing across legitimate medical professions needs to happen. And indeed, the data controller for the NHS, Dame Fiona Caldicott, has said that it's just as important to share data as it is to protect data privacy. And I think the sharing of data, the consent by patients will be a huge factor in terms of generating insight from patient data.
Is there a difference, for example, between Scotland and England?
No, more or less the same legislation in that sense. But nevertheless, what I've observed certainly over the last 5 years, where there was a reticence to share data between primary care and acute care, for example, that reticence is disappearing, and that where there's legitimate reasons to share data, then that data is being shared. And in fact, we see it today. There's a number of projects across England anyway, called the Local Healthcare Record Exemplars, and they're predicated on data being aggregated across entire healthcare economies.
Very interesting. Can you tell us, we have two disciplines, medicine and data science. And can you tell us how the two disciplines get merged together to one big new knowledge?
Indeed, I think that's one of the real challenges actually, as healthcare rapidly becomes this big data industry. There really aren't enough data scientists and bioinformaticians, and so there's a real need for a capacity and capability review, and in fact the training of new data scientists, or indeed training medical professionals in some of the aspects of data science. There's one thing that is an absolute truth within healthcare is there's an awful lot of data, but there's not a huge amount of information. And in the next 3 to 5 years, a combination of data science, standards in terms of information models, and interoperability will generate the environment for really generating information from data.
Richard, you are a digital health consultant. In which profession did you start? For our young
Well, indeed. I stumbled into healthcare IT. I originally trained as an engineer, mechanical engineering. I then retrained as an operating department practitioner and specialised in anaesthesia in the UK, or supporting anaesthetists. I then came to Europe and worked in the Netherlands as an anaesthetic technician. So I practiced anaesthesia, supported by a doctor. And it was through that I got involved in IT. We created a computer program with the Erasmus University's computer science department to measure certain physiological measurements. And when I came back to the UK, the hospital I worked at was implementing a new EMR, electronic medical record system. And one of the consultants said to me, "You know something about IT, you can be in the project." And for the next 25 years, that's all I've done.
But this is really interesting, because now it's your, I think, third or fourth profession, yeah?
Indeed.
Yeah, yeah, that's great.
I have had a liberal education, and I think particularly when you look at healthcare IT, it's a combination of skills. It's a combination of people skills. You know, healthcare is a knowledge business, and it's becoming a data business. So understanding a bit about the practice of medicine, understanding a bit about technology. But the reality is applying those two disciplines to the clinical and business challenges of healthcare systems is really where that mix of skills really comes together.
And if you compare now the situation in Scotland and in Germany, what is your impression?
I don't think they're massively dissimilar in many ways. Healthcare generally has lagged behind other industries in terms of adoption of technology. However, the economic environment of an aging population and a population that's living longer with multiple comorbidities, there's this concept of the scissors of doom where expenditure and tax receipts are diverging, and therefore something pretty dramatic. In fact, that was the Wanless report in the UK identified that some 20 odd years ago, and recommended that there was significant and transformational change in healthcare. And it seems only just now that we're starting to enact that. And I think the digital revolution enables that transformational change. Yeah,
that's a great conclusion. We have to look behind the borders. We can learn from other countries. There's a lot of good or even best practices from other countries, and that's why we talk together. Thank you, Richard. Our community, thank you.
It's a pleasure. Thank you for your time. Appreciate it. Bye bye.
So,
thank you.
See you.
Cheerio.
Be healthy.
Bye bye.